Ladies and gentlemen, it's my pleasure to present work done by Care Somalia. My name is Ibrahim Sheikh. I'm the Emergency Watch Program Manager for Care Somalia. Care Somalia was able to do an intervention called a localized community-led approach for delivering emergency water tracking intervention to hard-to-reach populations in southern Somalia. In late 2021, Care received a lot of appeals for emergency water tracking in Afmadow district. Specifically in a village called Dobley and its environs. Though Dobley was accessible to the care teams, the target areas for the emergency water tracking that were outside Dobley, around 20-30 kilometers, were not accessible to the care teams because the area was under the control of armed groups. So we faced a serious situation where people are in a water crisis, but the care teams cannot access those sites. So we have to look for an alternative way of undertaking the emergency water tracking. We have to resort to an approach called community-led emergency water tracking. So we quickly consulted the local community, comprising of local elders, businessmen, women, youth, and the local administration to help us. So why was the need for intervention great in the area? The area is a highly inaccessible place because it's under the control of armed groups. The severe water crisis was so large that people were able to just get access to minimum supplies of less than 2 liters per person per day. And women and children were severely impacted by the water crisis. So we engaged the local community, tried to see the possibility of them leading the process. We had a very fruitful discussion where the community was very receptive to our idea and they accepted to lead the process. After agreeing with the community structure, Care to do a rapid training for the community structure in terms of how to do registration of beneficiaries, the selection criteria, water safety, as well as how the local structure and care teams can jointly do monitoring of the water delivery systems. After doing the rapid training, resorting to the care's list of approved vendors list, we called for quotations from the approved vendors list members, and after subjecting to the normal procurement processes, we selected some vendors out of the approved list, and the process started of delivering water to the respective sites, the process being led by the local community structure. Then the care meal team was able to do remote monitoring of the intervention through engaging with the local structure and also engaging with the communities in the respective sites, the water management committees, the water tracking beneficiaries, to triangulate information on what the community structure was telling us vis-a-vis what we were able to find out ourselves straight through the phone contacts. As a way of ensuring safe water supplies, Care chose deep boreholes that were rehabilitated by Care, and we subjected the water supplies to water quality monitoring before the water tracking process started. The results were very encouraging of the intervention. It was very effective, and delivery of emergency water tracking was possible to the hard-to-reach populations, where every village was reached with the allocated water, and the community on the ground, especially the water management committee, were able to review and monitor water as it was being delivered. We were also able to find out from the beneficiaries through phone contacts that every beneficiary who was registered to receive water received and was able to receive the planned allocation. The other result was implementation was very timely and very effective, without any specific stage of the procurement process being compromised. And Care Wash team was also able to monitor the water delivery remotely from our safe area in Dobley. We were able to find out that the vendor is able to deliver the required amount of water on a daily basis as per the program. And the water management committee on the ground at the site of water delivery were able to confirm that the right amount of water was delivered as per the schedule. And in addition, we were also able to confirm from beneficiaries that every individual received the required amount of water. What were the lessons learned? It was very clear through this intervention that with minimal support, technical support, community-based humanitarian interventions are possible, especially in areas where humanitarian actors cannot reach because of security. And it's possible now through joint operations like this. Aid agencies can empower community structures and make it able to deliver the planned humanitarian interventions with minimal support. Thank you so much.